Hello everyone, my name is Navid Zadeh. I'm a physiotherapist from Rose Clinic Physiotherapy, and for those who don't know this program, I just give brief introduction that I've been producing a health program which called Selamat since 7 years ago, and the content of the program is published in our website. We have been speaking about different type of method of treatment which physio can apply in their day-to-day practice, and also the standard of physiotherapy in different countries and how certain organizations can participate to increase and raise the standard of physiotherapy not only in UK but also abroad. And we can see that organizations such as WCPT, Chartered Society of Physiotherapy, have played great role in increasing the standard of physiotherapy. Now, today I have invited a special guest, and we will discuss about different issue of physiotherapy. And her name is Mrs. Karen Lay, who is chairman of Physio First organization. And a few months ago, we had Mrs. Karen Middleton, Chief Executive of Chartered Society of Physiotherapy, which gave great information about standard of physio in UK. Now, Karen, very welcome to our show.
Thank you for asking me. I'm pleased to be here.
Thank you. Will you please introduce yourself to our viewers and all over the world, and give a brief history about your background?
Okay, so my name's Karen Lay. I'm a chartered physiotherapist here in the UK. I've been a physiotherapist for most of my life, all of my career. I worked in various different places in the NHS, in the National Health Service in the UK. I worked abroad in the Middle East, and for the last 25 years I've been in private practice in UK. Okay. And I became a member of Physio First in 1988, and this April I took over the role of chairman.
Well, congratulations once again.
Thank you.
As the chairman of Physio First. People are usually familiar with Chartered Society of Physiotherapy, since we have in every country such an organization. Mm-hmm. But it's quite interesting that UK is amongst one of the few countries that have a different organization which is called Physio First. Could you please explain a little bit more about Physio First organization?
Yeah, so as you said, the governing body over all the chartered physiotherapists in the UK is the Chartered Society of Physiotherapy. Mm-hmm. And as you just said, you had Karen Middleton, who is the chief executive of that, our society, in this studio recently. So underneath the umbrella of the Chartered Society, there are several what we call professional networks, sort of subgroups, and they might be representing physiotherapists that work in neurology, say, or pediatrics. And Physio First is a professional network which represents self-employed private physiotherapists. From the Physio First perspective, working in private practice can be, a little bit isolating. We know that we have up to just under 3,000 members in the UK, all working privately, and it can be sometimes isolating. So Physio First was set up to represent the needs of those people working as self-employed private physiotherapists. And obviously the Chartered Society represents all of us physiotherapists, but the vast majority work in the NHS. Yes. And in the National Health Service, there's a lot of pressure on service. We know that, demand outstrips supply. Yes. And so physiotherapists have to work smart, and we're all looking for evidence of what works and what doesn't work. And so sometimes the National Health Service physiotherapists will perform a triage service. That's different usually to what happens in private practice, because our members see patients as they come through the door and in effect work in the same way as what's called a first contact practitioner would, because they have to assess, use their clinical reasoning, decide on the best course of treatment for the patient, and then treat them to discharge. Yes. Or refer them on if necessary for scan or further investigation or whatever it might be. So I think that's a big difference. We have the luxury of more time with the patient, and so can be more expansive perhaps in the treatment that we do.
Okay. Well, I was looking through Physio First website, and I noticed there was such a great information out there. And also another thing which I like to discuss briefly is this great journal, In Touch, and I have had produced one or two program by discussing one or two article. This is it, the Physio First magazine, which I want you give some information, please, about this.
Yes, and I brought one with me too to show you, but I left it in my bag. So this is our quarterly journal. It comes out 4 times a year, In Touch. We are very lucky in Physio First in that In Touch has been going for a long time, and we ask authors to write for us, and they're usually very people who are very current in the UK, who are doing research. And they very generously write for us for In Touch. Every edition has a theme. As you can see, this one is the upper limb. And very often the people that write for us In Touch also come and lecture to us at our annual conference, which takes place in Nottingham in March, April time. This one that's just been this year was called Hands On, Hands Off, What is the Evidence, which is just references what you were saying before. Next year's is going to be called Brave New World, which is about the influence of technology and how it's changing how we deliver health services over the whole world, not just in the UK.
Exactly.
And so this is a great source of ongoing education for Physio First members.
Very good, and a great article, by the way. Now, Karen, setting up a private practice in every country has certain criteria. What are the rules to set up a private practice here in UK?
Yes, well, it's a good question, Navid, because it can be, a bit of a minefield. And for what we find in the UK is, most physiotherapists qualify and then they start their career in the National Health Service, and they perhaps do, 2 or 3 different placements in the health service. We used to, perhaps not so much now, but certainly when I qualified a long time ago, we worked perhaps for 3 months in neurology, 3 months on a surgical ward, 3 months on orthopedics.
Rotation.
And that way you kind of found out where your interest lied, and then you sort of specialised after that. Now it's a little bit different, but many of our members, start working in the National Health Service and then decide they want to move into private practice. And so, where do you start? So exactly for that reason, we collaborated earlier on in the year, last year, with the Chartered Society of Physiotherapy, and we co-produced a really good resource, which is an e-booklet. You can download it for free. Anybody can download it for free from the Physio First website, which is www.physiofirst.org.uk, and it's called Starting in Private Practice, the Essential Guide. In fact, I brought a copy with me. But so you can print it out yourself, and that has a wealth of information, ranging from the business methods that you need to look at. Do you want to be a sole trader, or are you going to employ other people, or have associates working with you? Are you going to work from home or from a premises? Rules around what local councils expect you to do. For example, if you're doing acupuncture, also there are specific rules around sharps disposal and having sinks in the room and all this sort of thing. Where are you going to get your patients from? What is your brand going to be? All of these things are covered in that booklet. And also our members can get further information by obviously, asking Physio First.
As long as you're a member of Chartered Society and registered with her CPC, you can start to work as a physio wherever you prefer to. Am I right?
Yes, you're absolutely right.
We
are so
quite
lucky.
Convenience as well.
We're very lucky in United Kingdom, really, because we have both clinical autonomy, which means that, you could come and see me just because you see my sign and you walk in and you ask about your back pain.
Exactly.
And so on. We don't have to have a referral from a general practitioner, from your family doctor to treat you. Obviously, we might contact your family doctor to say that you're having treatment as a matter of courtesy, but we have clinical autonomy to decide the treatment ourselves. So no, there's no restriction on what kind of premises you work from, and we do know that many of our members, it's a big variety. Some will have a dedicated practice premises, say, like mine. Some will work from home. Really, the regulations around that are to do more with the local council about having enough traffic access to have extra cars and so on. and clinical standards from acupuncture in terms of sinks in the room and sharps disposal and so on.
Normal standard criteria.
But other than that, no. It's or some people, members can work as part of a gym or a leisure centre. There are many different models.
House, schools, whatever.
Many different models.
Now, in the last decade or two, the level of physiotherapy has increased to much better standard, and that's due to research in this field. And therefore, many physios desire to work based on evidence. And the vision of Physio First organization to provide cost-effective and evidence-based practice. Now, Karen, would you please explain about this vision of Physio First and how that can be achieved in practical terms?
Sure. Well, Physio First members have been collecting data on their patients for over 10 years now, and we have over 50,000 data sets. And this was a vision started initially in conjunction by Physio First, in conjunction with a charitable trust that we are associated with called PPEF. This stands for Private Physiotherapy Education Foundation, and it provides money to enable the furtherance of education for physiotherapists and the public about physiotherapy. So we started to collect data. We asked our members to input data about their patients, including numbers of treatments per episode, what modalities they used for each treatment, whether it be exercise, information and advice, manipulation, mobilization, electrotherapy, whatever, and the outcome of the treatment. So that has been going on for over 10 years. And so with this big bank of data that we have, which is, by the way, independently analysed, totally separate to Physio First, independently analysed by University of Brighton. So we have colleagues there who work in a team on what we call the Data for Impact project. And so now, with that data, what members can do is when they reach a certain level of data, they will get an individual report. So firstly, they can use that individual report to benchmark themselves against other practices in the UK, because we have coverage UK-wide. So they can look to see, for example, what is the average number of treatment sessions for a shoulder injury that they do. And if it's, way higher than the average in the UK, they might think, well, actually, maybe I need to go and do some more study on shoulders and get my outcomes better, and so on. So it's very useful from that perspective. And then when we realise that healthcare is moving to all over the world, is moving towards looking at what is the evidence, how can we be sure that physiotherapy works, how do we know that what we're doing is the right thing, is backed up by the evidence. So in 2016, we asked the university to help us design a scheme, and it has become a kite mark called Quality Assured Practitioner. Now what that means is, if I as a practitioner input my data on all of these parameters to send it off to University of Brighton, so Physio First doesn't know anything about the people that are sending the data off, they don't know anything about the data.
And remain anonymous anyway.
All anonymous, and the university looks at it. Once I've completed 50 data sets, and the data that we're collecting is things like the waiting time, for example, because we know that's a big issue in National Health Service. Patients often wait a long time before they can get to treatment because of the pressure on the service and so on. So waiting time between referral and start of treatment. Difference in FPS scores, so this is functional, physical and subjective score from the start and the finish of the treatment episode, so difference in FPS scores. Goals achievement, so goals that you've set with the patient at the start when you first see them, have they achieved them fully, partially and so on. Goal achievement, outcome of the referral.
Number of.
So is it discharged fully better, or discharge and return if not quite right, or referral on for MRI scan and so on. So a measure of that, and then the number of treatments that you've had. So those are the 5 parameters that the university looks at. And they have set a baseline, and if I as a practitioner achieve over the baseline in 3 out of those 5, then I will achieve this kite mark of Quality Assured Practitioner.
or quality assured clinics.
And later on, we have designed, this has just been last year's quality assured clinic. Now that is to allow for the fact that we know that many of our members will, run a practice. They will be the practice principal, but they might have 6, 7, 8 practitioners, all of whom work part-time for them.
Exactly.
So the university has designed this for us so that we can look at pro rata, the number of hours that they work, but they still all have to be inputting the data.
Okay.
Now, a really exciting thing that happened earlier on this year is that Bupa, as the biggest health insurer in the UK, asked all of their physiotherapy providers on their list to start collecting data. Well, in fact, they asked them 2 years ago, which was the last contracting period, are you collecting data?
Yeah.
But then it was just a tick, yes, I am. Now, this time in April, they said, okay, we want to see the data that you're collecting.
Yes.
And what they have said, which has been really a boost for Physio First, is they've said, we acknowledge that the Physio First quality assured clinic scheme, because they contract with clinics and not individuals, it fulfills our criteria for the audit, so you don't have to be audited in the same way that everybody else does.
This is incredible scheme, really, when I go through detail, especially when we look at the future, within 5-10 years' time, the outcome of this project will have huge influence on healthcare system. We as a physio even have a better idea what exactly is working, what is not working, what kind of modality is working, which type of hands-on treatment have better outcome. So this is really a massive project, and I am sure the future will prove this. This is amazing, really.
We hope so. I mean, we mentioned Bupa before, but a point that I want to stress is that we know from our practice profiling survey that we do of our members that a large majority, maybe nearly 80% of what our members see throughput in their clinics comes from the uninsured self-funding public.
Exactly.
So we didn't just do this to work with the insurance companies like Bupa, because we know that that's a small percentage of what members see. Slightly different in London, maybe, it might be higher, but provincially, it's mostly it's the public. Now, we know that the public use evidence-based referrals, you might say, word of mouth.
Exactly.
You might ask your friend, do you know a good physio? Might you look at, we're all used now to looking at reviews like TripAdvisor, with Amazon. Before we buy something, we read the reviews. Healthcare is no different. So we hope that by having this kite mark of quality assured practitioner and quality assured clinic, this is a way for the public to be able to learn more about what physiotherapy can be helpful for, because we know it has a huge impact on the way people live and their health. But secondly, to be able to be reassured that the physiotherapist that they're seeing has achieved this level and is working in an evidence-based way. So our University of Brighton colleagues were asked to present on this in the recent WCPT in Geneva, which is where you and I met. And so they presented 2 platform presentations and a poster presentation precisely on this whole project, which was really good for the university, and is looking like we're going to be able to collaborate with other physiotherapy associations. We had discussions with Australian Physiotherapy Association and Dutch Physiotherapy Association about data collection, because everybody is looking to say, well, okay, where is the evidence? We have to evidence our treatments, and how can we do this?
Yes, well, certainly this will be quite popular amongst other countries as well, because it's something new and creative, and since it's going to be controlled and reviewed by university, which is going to be really great for future data, and give kind of direction where the university can focus, where physios can focus to update themselves. Now, Karen, we are reaching end of the program. Would you talk a little bit about your own experience from physiotherapy and any other favorite subject that you like to discuss?
Well, I've been a physiotherapist since I qualified at age 21, but my career has taken varied turns, as I think probably a lot of physiotherapists, because there's such a great career for working in different, different places, different fields. So, as I said, I started working in the National Health Service, and then I went to Australia for a year, and then when I came back, I applied to work in the Middle East. So I started to look at different things like nutrition for people, and how exercise affected the lifestyle and so on, which is very important out there. And then I came back to the UK. I studied acupuncture. After a visit to China, it spiked my interest in that. So I studied acupuncture, and then for the last 25 years, I've been in private practice. So.
Now, well done. Another question: do you exercise by yourself?
I do. I exercise more now, actually, than I used to. I play golf. I go to the gym, and I run.
Unfortunately, in some country, I have noticed that some physio don't exercise, and that's quite a shame, to be honest. Because as a physiotherapist, if you don't train, you cannot understand the effect of training on injuries and condition also. So therefore, I always advise my colleague that they have to train and keep fit to be able, first of all, to deliver a good service, and secondly, be an example for their patient as well.
Absolutely. I mean, we know, going back to the Data for Impact project, we know that when our members tick the modalities that they use in terms of what they use to treat their patients with, the top one is always exercise and advice.
Exactly.
So every patient that comes in, you should be talking to them, you should be advising them, you should be talking to them about exercise. The second one is exercise therapy. Yeah. So the exercises that you go through with them, and you might say to them, okay, this is your homework, this is what I want you to do, we're going to work on this together. Yes. And the third one usually is some kind of manual therapy. Might be soft tissue techniques, or it might be mobilization or manipulation, obviously dependent on the condition that you're treating. Yeah. But those are very high. So when the university looks at the figures, they can produce some statements that if we as Physio First say this statement, we need it to be backed by the evidence. So on our website now, we have a certain number of statements, and when you click on it, you will see the evidence underneath. Exactly. So one, for example, with back pain, we know back pain is a huge problem worldwide, but certainly in the UK. We can say that the sooner you see a private physiotherapist, the less treatments you will have to alleviate your problem. Yeah. And that's because the data shows us that patients come prior to 6 weeks. I know sometimes, some of the guidelines say, if you're still having pain at 6 weeks, then see a physiotherapist. Most of our members will see the patient before 6 weeks, but they'll need less treatments if they do so. Exactly. And we can show that with the data that we've collected.
Well, from my own experience, the place where I work, there are many Australian people. It's quite interesting that they come to physio straight away within few hours or few days, and they receive much better and sooner result than waiting few weeks. Anyway, Karen, it's quite interesting. You mentioned the use of modality in physio, as we know that the guideline of Chartered Society of Physiotherapy and also Australian Chartered Society has banned use of modality for instance, electrotherapy for low back pain. What do you think about the use of modality? The reason I'm asking this because although in Western country the main treatment method include exercise and manual technique, so what do you think about the modality?
Well, I think there is a place for electrotherapy modalities, and our data from the Data for Impact project tells us that our members do use electrotherapy. But I think with all treatments, you have to look at the evidence behind it, and it's about the right application of the right modality to the right patient at the right time. Exactly. And if you look at evidence from one of our recent speakers at our conference, Professor Tim Watson, his evidence is strong for electrotherapy, but as I say, within those parameters. So. We know that we do use electrotherapy, but as I say, the top three for our data is always advice and education about the condition. And that encompasses, just that phrase, education and advice, means that you're having a discussion with your patient, you're talking, you're informing them about their condition, you're getting them on side, you're talking to them about goal setting, what the responsibility for them, what you can help them to do to help themselves get better. Because what we're not doing is treating people and making them dependent on treatment. What we want to do is treat them and make them informed. That's reassuring then, so you're taking away any fear avoidance behaviours and so on, and you want patients to be active in their own recovery. So that's always the top one. But then, as I say, most private physios will use some hands-on techniques, and I think patients value that a lot.
Exactly. Well, we are reaching the end of program, and usually at the end of each program I give a small tip to my viewers, and today I would like to I ask you, please don't spend too much time behind computer and phone devices, because there is huge evidence that when you use them on regular basis, there are certain issues. First of all, the posture of your entire body, from finger which going to flexion, wrist go to extension, elbow is flexed, the shoulder are elevated and forward, neck and head, shoulder, and also we are dealing with sedentary lifestyle, so please make sure to spend as less as possible time on front of computer unless you have to, and play less game and activity on your phone, because there will be a huge amount of problem which we will face in near future. But unfortunately there is lack of information in media, and also government are not supporting this idea at all at the moment. I hope that physiotherapists will come with a great idea about sorting out technology related problem as well. Well, Karen, thank you very much. I really appreciate your effort to come here today from long distance, and wish you the best.
Thank you very much.
Have a lovely day, and if you have any question or any query regarding this program and other related subject, please contact us via our email. And if you have any question from Karen, we will make sure that she will receive your feedback as well. See you next time. Have a great day.